Today we're going to talk about heart health for women because February is Heart Health Month, and it's a month for people to raise awareness with the women in their lives about the things that they should be looking out for, about the tips that can help them to lead healthier, happier lives. And I'm really thrilled to have Dr. Nazli Parast here today from the Ottawa Heart Institute. Welcome. Great to have the chance to talk to you.
Thank you so much for having me. Um, I'm Nazli Parast. I'm the advanced practice nurse with the Women's Heart Health Clinic at the University of Ottawa Heart Institute. I'm happy to be here and answer your questions.
Yeah, well, and I really appreciate it as well because I think for a lot of women, we hear about Heart Health Month. We hear about the whole idea of, taking care of our hearts, but we don't actually know what that means. We're not entirely sure. Does it mean healthy eating? Does it mean exercise? Does it mean both of those things and a whole lot more? So, can you give us first of all, some top tips about what women should be doing so that they can prevent heart disease in the first place?
For sure. So one of the things I want to bring everyone's attention to is that heart disease is #1 killer of women worldwide. So it kills five times as many women as breast cancer. So it's alarming. So I want everyone to know that. And there are 80% of the heart disease actually preventable. So we can actually do something about it. And one of the major thing is first to be able to live a healthy life, live a smoke-free life, managing a stress. I sometimes say avoid the stress, but you can't avoid the stress. You have to just manage it. And there are so many ways that you can manage the stress. Actually, at the Heart Institute, we have YouTube links for managing stress and anxiety. They're super helpful to give some tips to individuals, as well as healthy eating. Again, we have some resources on that, making sure we're having enough fruits and vegetables in our life. And one of the big thing is the exercise. So you want to make sure that you're active. Again, if you don't know where to start, we have YouTube links that you can look at. That's Ottawa Heart Institute based. And our physiotherapists actually created those.
So, yeah,
Yeah, go
go
ahead.
ahead, Dr. Press. Well, I was going to ask about the fact that we really tend to think of heart disease as a male issue, frankly. I mean, I think that's changing, but I'm not sure that when you say heart disease that you don't immediately think of men before you think of women. And so that's a danger zone too, right? If women don't recognize that our risk is actually that high. I mean, the stat that you quoted right off the top, that's
For
pretty alarming.
sure. For sure. And it's recognizing those risk factors, those symptoms, and as well as the risk factors is a huge important aspect of it, because we do share similar risk factors such as diabetes, smoking, high cholesterol, physical inactivity, stress and anxiety, and high blood pressure, similar risk factors to men. But we have to keep in mind that women are at greater risk of heart disease when they do have these risk factors. So I could talk all day to go over how different that these conditions will impact women, but we also have a unique range of risk factors, such as menopause. So the risk of cardiac disease increases after menopause, and then pregnancy-related complications, such as having gestational diabetes or gestational hypertension, preeclampsia, eclampsia, a premature delivery, a small for gestation of the baby, as well as having a stillbirth. And another thing that a lot of people don't know is potentially being on birth control medication also increases the risk as well, so on certain birth control medications, and having polycystic ovarian syndrome and history of breast cancer or gynecological cancer. So the list is quite intensive.
That's intensive, and it's got to also be really overwhelming to a lot of women. So, if we are thinking about simple things that we can do to be aware of our heart health and to take action, like we've talked already about the prevention aspect of it, but simple things that we can do to be aware and make small changes and then also be aware of changes in our body, which might indicate that something is wrong. What do you recommend?
For sure. Well, the most important thing is to understand if you have the risk factors.
Okay.
So once you understand the risk factor, you need to advocate for yourself. If you ever, so get the resources, get the understanding of it. We do have actually a guide for women's heart health that provides the detailed information. So knowing where you're at and seeking help and advocating for yourself, that's the number one. That's the key things for everyone to know. And the other things that is also different is knowing the symptoms of heart attack,
Right.
because they are actually different between women and men. Men most often having the chest pain radiating through the arm, the thing that we see on the TV, but for women, it's actually different. We have symptoms such as chest pain and which some women actually describe it as chest tightness or chest discomfort. They don't necessarily say chest pain. So recognizing that they are the same thing, as well as sometimes women actually experience upper abdominal or stomach pain or jaw pain, shortness of breath, fatigue, unusual fatigue, nausea, vomiting, palpitation, abnormal excessive sweating. Women tend to have 3 or more symptoms when they present with the symptoms for heart attack. So it's important to know that it's not just a simple chest pain that radiates through the arm. There are a variety of symptoms that you should be looking for as well. And the only way to know if that is related to your heart is to seek help, advocate for yourself, and get testing done.
So, two questions then. The advocating for yourself part, that's really big for us here at the Honest Talk. We're often trying to provide tools for women to know how they can advocate for themselves. So, what do you recommend? I mean, what do you suggest for women who might be concerned that they either have risk factors or that they present at hospital with symptoms?
For sure. I usually say knowledge is power. The more you know, the better you're able to advocate for yourself. So we have plenty of resources for people to walk through and look at to see if they have any of those risk factors. And once they have identified it, it's important to have a discussion with the family physician or the nurse practitioner to go over those symptoms, those risk factors. And then if they do have symptoms, you want to again communicate with the family physician. If the symptoms are having symptoms of heart attack, then you definitely have to present to the emergency room. It's important that you put yourself first. As a caregivers, we tend to put others first, but it's so important that we put ourselves first and we actually seek help and present to the emergency department and have them to assess us. And we also have to be able to when you know your symptoms, when you know what's going on, you're able to better explain those to the staff in the emergency department, and they can walk you through different testing. And if something doesn't feel right after, if they didn't find anything, if something doesn't feel right, it might not be right. So you might have to follow up after that. You might have to be persistent to get referrals and have your family physician or nurse practitioner to advocate for you.
You answered my second question when you said that you have to take care of yourself, because that was what I was going to ask. I mean, women do tend to put their own health aside because they're busy looking after others, or they're just busy in general and they think this will pass. The problem is when you do that, especially in the case of heart disease, the outcome can be catastrophic.
For
So
sure.
so your advice is take this seriously, trust your instincts. If you feel that something's wrong, advocate for yourself, get to an emergency room.
Definitely, definitely.
Yeah.
And if you do have the risk factors, don't wait till you get the symptoms. So advocate for yourself early on, that you're try to get as much resources and understanding and have a screenings done. So you're going to be in control of your health.
Any final thoughts on where women can turn for more resources on this topic?
For sure. So we have resources. We have different video clips. At the University of Ottawa Heart Institute has various video clips about exercise, nutrition, and I can guide and stress management. I can guide everyone through having a healthier lifestyle. There's also the Canadian Women's Heart Health Alliance, and that I encourage anyone and everyone to join. It's an amazing way to connect and collaborate, as well as advocate for women. And there's also, if people have already had a condition, there is something that we have a support group called Women at Heart Support Group. So don't feel like you're alone, because there are so many women going through same thing. And having the support, it's amazing, because you can be empowered, and the more knowledge you have, the better it would be. We also offer a group session, a patient education session at the Ottawa Heart Institute, and that's on the calendar on the website. So take advantage of all these resources, as well as the guide that we have a guide to women's heart health, which I usually tell people, just type in Google a guide to women's heart health and UOHI, and you will get to the first link that is there is actually the guide, and you can go through it and learn more.
Well, and the great thing is that though the Heart Institute is based in Ottawa, the resources that you're offering are online. So they're available to women right across the country so that they can implement changes and have access to information no matter where they're located, and then either take that to their physician if they're lucky enough to have a family physician or a nurse practitioner or a medical clinic to follow up on their own care. So so I want to make sure that our viewers know that as well, so that there's access nationally to this information. And you know what, you were speaking our language when you said that women understanding that there are other people going through, other women going through the same thing that they are. There is power in that. And so I appreciate you mentioning that too. Dr. Nazli Parast, it's been a real pleasure to talk to you. Thank you for joining us on Honest Chats to help the Honest Talk community of women really understand better how they can take care of their heart health.
Thank you so much for having me. I'm so glad to share this information.